The human knee. Stability of the knee. The knee uses a series of bones, muscles, ligaments, tendons, and cartilage to make itself a true masterpiece of evolutionary engineering. To prevent wear and tear, the knee has evolved to use a thin layer of cartilage to protect and lubricate the bones. The cartilage highlighted here is known as the lateral meniscus. This allows the lateral condyle of the knee to pivot smoothly for many years without a single problem. The cartilage highlighted now is known as the medial meniscus. This allows for the same properties to take place on the medial side of the knee. There are two ligaments located in the center of the knee that provide stability. The first one highlighted here is known as the ACL. This ligament helps to prevent anterior movement. The second ligament, known as the PCL, crosses behind the ACL to provide support against posterior movement. The knee is also held together medially by the MCL and laterally by the LCL. Normal range of motion of the knee. The average leg can extend to 0 degrees or use flexion to bring the leg into the 150-degree range. However, the knee can also internally rotate and externally rotate. Because the knee is capable of these three movements, the knee is categorized as a modified ellipsoid joint. Knee vulnerability and possible knee injury. One very common injury of the knee is a torn meniscus. There's a flap tear, torn horn tear, bucket handle tear, and transverse tear. Another very common injury in sports is a torn ligament. A torn ligament will reduce stability of the knee and may cause severe pain. The knee in motion. Bones used in the knee during cycling. There are two bones used in the knee during cycling, the femur and the tibia. Main muscles used to generate power during motion. There are many muscles used to generate power and stability for the knee and the rest of the body. These muscles are the tibialis anterior, gastrocnemius muscle, and the soleus muscle. The next in line are the quadriceps group, the hamstring group, the gluteal group, quadratus lumborum and associated muscles, and the erector spinatus and associated muscles. Cycling-specific knee pains and their causes. There are two main injuries that plague cyclists, patellar tendinitis and patellofemoral syndrome. The main causes for these injuries are cycling at low cadences, saddle is too high or low, forward or backwards, foot position, and crank in arms unproportionate to the body. Cycling at too low of a cadence will create undesired levels of stress on the patellar tendon and the patella. This will also cause muscle to grow too fast, causing the patella to shift up. Cycling at a proper cadence will reduce the risk of this problem. Degrees of range for the knee in this movement.